Hello everyone and welcome to today's video. If you're new to the channel, then welcome. If you're not, then welcome back. And today's video is going to be talking about the role of the healthcare assistants and their contribution to healthcare. The healthcare assistants are such a vital member of the MDT team, and their roles and responsibilities differ depending on where they work and what departments they're working within the hospital. Many of the healthcare assistants' roles and responsibilities are aimed at providing the highest level of patient care and patient safety, and many of the healthcare assistants in the profession try their utmost best to participate in these roles and encourage good health for all patients they come into contact with. Healthcare assistants' duties usually include maintaining patients' dignity, also ensuring all patients are washed, dressed, cared for, fed, and also using skills of experience to be able to distinguish when something just isn't right. Many people think that all that healthcare assistants is wash the patients and feed them, but they do a lot more than that. I myself have worked as a healthcare assistant, and I've also met many healthcare assistants that can also do a variety of different things and been taught a variety of different skills. These skills are things such as venipuncture and cannulation, which is essential in many departments such as accident and emergency and high specialised areas. They can also perform things such as ECGs, which is taking a reading of the rhythm of the heart, and many healthcare assistants also can do vital signs such as blood pressure, temperature, pulse, and they can record these and be able to escalate these effectively to a registered nurse or any clinician working in the department. Many people get the vibe and get it wrong to the fact that they don't really understand what the healthcare assistants do, and they class them as unskilled workers. In my opinion, they are very highly skilled and they are very important members of the team. They can tell us a lot, and a lot of things that they notice can in result escalate to enhancing patient care. We as nurses and other clinical specialists aim to be able to assess our patients and be able to observe things and then use the things that we've observed and we know about the patient to develop an effective care plan. But as in the same with everything, we don't always catch everything, even though we aim to. And this is where our healthcare assistants are so important, because sometimes they can pick up things that we just haven't missed or have missed by that 1 second, and they're also another contributor to patient care, and more eyes is better than one. They work with the patients a lot and so patient focused, and they work directly with the patient. A lot of their work is involved in being around the patient constantly, and when they're performing these tasks, which people just see as wiping the bottom or feeding a patient, these tasks can tell you so much more information than a detailed assessment that's not looking at a person holistically. When they watch these patients, they can notice any unusual markings, any pressure sores, any lesions, any skin density issues. They can see a lot of things just from watching a patient, and we are taught this at the beginning of nursing school. It's not just washing somebody, you're also assessing while you're washing this patient, and healthcare assistants pick up these skills and be able to find things and then either act upon it if it's within their competency or escalate it to the registered nurse in charge of those patients. Feeding a patient, people just see it as feeding somebody. It's not just feeding somebody. When you're feeding someone, you're also completing assessment. You're looking at the way the patient's swallowing. Can they manage whole foods? Are they swallowing it effectively? Are they having any difficulty when eating the food? It's not just feeding somebody. Anybody can feed anybody. You feed a baby, when you feed a baby, you're not assessing the baby, you're just thinking, I'm just giving them food because they can't pick up the spoon themselves. But in a healthcare setting, feeding is more than just putting a spoon to somebody's mouth. It can give you a lot of questions and give you a lot of answers about the person in order to form an effective assessment. In regard to doing the observations, some healthcare assistants do observations depending on trust, and I'll tell you now, people think doing a blood pressure is just doing a blood pressure, and doing a temperature is just putting a piece of equipment in someone's ear. It is so much more than that. What is the point in doing somebody's blood pressure and temperature if you don't know what it's meant to be and what it shouldn't be and what's high and what's low? if you're not looking at it like that, then there's no point in doing it. In order to do these vital signs, you have to be trained to a level where you know the differences and what is normal and what is not, and when to escalate something. And this is a very important skill to have. And for healthcare assistants to be able to do this, and in most cases escalate when something isn't quite right, takes a lot of skill. And many of them can do these things, and I think there's not enough recognition that's given to them, because it is a hard thing to do and be able to notice. You just think about this: you've took somebody's temperature and someone's pulse, and you've just written down what it is and haven't told anybody because you don't understand what you're actually doing. And then a few hours later or a few minutes later, something happens with that patient, and you didn't escalate it because you didn't know that there was anything to escalate. Whereas being able to have that training and liaise and notice when something's not quite right and report it to the nurse, you're potentially saving somebody from further distress and pain, and that is an important skill to have. I cannot emphasize this enough. And many healthcare assistants do this. We need to take bloods from patients sometimes, and being able to put a cannula in isn't just putting a needle in somebody's arm. You need to make sure that you're not hitting an artery. You need to make sure that the placement of this cannula is correct, and you're not causing any more pain or trauma to the patient. It is a skill which is needed. So I know I'm going on a bit of a rant and tangent here, but it just really upsets me when people see these people in these positions, and they see them as lower when in fact they're not. And if you actually work alongside them, you'll see differently, because they are so important, and in my opinion they do possess skills that are not teachable. Many healthcare assistants are happy to just stay at healthcare assistant level, and that is absolutely fine, and that is great, because we need people like that. We need people that are happy to just stay as healthcare assistants and not move up. We need people that are just happy to be a domestic and not want to move up into any management roles. And moving up isn't for everybody. Some people are just content and happy with what they are doing and what the position they're at, and that is great. We need balance. Not everybody can go for the high jobs, not everybody can go for the low jobs. We need a balance. And I think it's so nice when you see these healthcare assistants say, you know what, I'm happy doing what I'm doing, and that's absolutely fantastic, that you come in and give your all and do your best because you are happy what you are doing. And that is such a great thing to see. There is also, on the other hand, the healthcare assistants that do want a bit more. They've done the HCA role and they feel like they've gained a lot from doing it, but they just want a bit more responsibility and they want to do more. And these kind of people tend to go for the more band 3 positions, which is like a higher level healthcare assistant, and with that comes a bit more responsibility and a bit more skills that you can learn to contribute more to healthcare and help nursing staff and doctors, because you're trained to the next level. Also, some healthcare assistants decide that they want to take part in the new nursing associate program, which you then have to go to uni and do a 2-year foundation degree program for. But at the end of that, you do receive a PIN number and you are a nursing associate, when again the job roles and responsibilities are heightened and increased. Your pay is increased, but you feel like you're doing a bit more and you're expanding yourself, you're developing, you're moving up, and your skills are forever expanding and moving on. Which is great. You also get healthcare assistants like myself that have worked at HCA level for a while and want to be a nurse, and then these guys go to university like myself and will do the 3-year degree, which is the Bachelor's of Science in Nursing, to then finish as a band 5. As I said, this route isn't for everybody, but there's loads of different routes. I'm going to do a video on different routes into nursing, but it's just, as I said, it depends on you and it depends on what you want to do and how. But I just wanted to do a quick video and explain the roles and responsibilities of the healthcare assistant, because people just, as I said from the beginning, assume that it's just washing and feeding a patient, but it's not. It's so much more than that, and these guys are so helpful, especially talking from a student nurse's perspective as well. When you first start on a ward and it's daunting, and it's always busy and it's very busy, the nursing staff don't always have, and doctors don't always have that time to be able to show you everything that they probably could. But these are the times when usually the healthcare assistants will come and step in and make the time to show you these little things. They're an extra pair of a learning resource, really, when you can't get certain information, usually they know, they've worked in these settings and areas for so long. They can give you the answers, they can help you settle in, they can show you things like where the storeroom is, where the staff room is, where a type of dressing is, where we keep the ECG machine, where you keep the blood pressure machines, where you keep the spare parts for the blood pressure machines, where you keep the tympanic ear covers. There's so much information that they can give you just from experience of working on a ward and seeing it being carried out. Think about this: if you're a healthcare assistant that's worked on a ward for 3 years, as an example, in them 3 years that you've worked there, I'm sure you've saw tons of student nurses and junior doctors that have come and gone from the wards, and you get to observe the kind of things that they're there to learn and achieve. You assess and observe the kind of things that their qualified nurses and doctors go through with them. You kind of get a grasp of what their learning objectives are and the type of things that they'll need to take from the placement, and you get that because you're familiar in the environment and you're observing other staff doing this. And if you're observing other staff doing this, you kind of have an idea of what that student will need to know, therefore they contribute to your learning too, because they've seen it many times before. Believe me, if you're a student nurse just starting out, when you start your first placement, please get to know these professionals. Yes, they are not nurses, but they still carry out many tasks that nursing staff do, and they are just as helpful. So please get to know your healthcare assistants, please treat them with respect, and please appreciate what they do. That is the message for this video. Anyway, that was just a brief video for today. It's just one of the many topics that I wanted to cover, just to shed my opinions and input on things. There may be things that I've missed out, and if I have, please comment below and let me know. Please give this video a thumbs up and please share if you care. Just want to wish everyone all the best in whatever they're doing. I know this is difficult times and unprecedented times, but just try and keep your head up as much as you can. Try and do things to distract your mind and just stay positive throughout, and we will all overcome this. See you later, or goodbye.